Welcome everyone. Today we're diving into an important and often overlooked topic: colon cancer. This isn't just any health concern, it's a formidable adversary. Ranking as the third most common cancer in the United States, colon cancer is a silent foe that can creep up unnoticed. Citing our reliable source, communitycancercenter.org, we understand that risk factors such as age, family history, obesity, physical inactivity, diet, smoking, and alcohol use can significantly increase the likelihood of developing this disease. It's a battle that requires our constant vigilance and understanding, which begins with knowledge. Knowledge about its prevalence, its severity, and most importantly, its signs and symptoms. Because, as with any battle, knowledge is our first line of defense. Now that we understand its significance, let's delve into the 10 signs of colon cancer that you shouldn't ignore. But, before we go any further, please like this video and subscribe to our channel. The first sign to watch out for is a change in your bowel habits. But what does this mean? Well, you might notice shifts in your routine like diarrhea or constipation. Even changes in the consistency of your stool can be a signal. Now we all have off days, so don't panic at the first sign of irregularity. But if these changes persist for more than just a few days, it might be more than just a bad meal or a stressful week at work. Changes in bowel habits could be a sign of colon cancer. This is because the growth of a cancerous tumor can interfere with the normal workings of your colon, leading to these noticeable shifts in your bathroom routine. You might find yourself dealing with constipation one week and then diarrhea the next. Or perhaps your stool has become unusually thin or loose. These changes might seem minor and easy to write off as just a temporary glitch in your digestive system. But they're not something to be ignored. They could be your body's way of telling you that something's not quite right. So remember, any persistent change in your bowel habits should be a cause for concern. It's always better to be safe than sorry when it comes to your health. Consult with a healthcare provider if you notice these changes. Early detection is key in the fight against colon cancer. Next, we have blood in stool or rectal bleeding, which is often a clear warning sign. This is not something to be taken lightly or brushed off as a mere nuisance. It's essential to pay close attention to the color of your stool, as it can provide vital clues about your health. Blood in the stool may not always be glaringly obvious. It could manifest as a darker hue to your stools, sometimes appearing black or tarry. This is due to the presence of digested blood, a condition known as melena. It's a subtle change that can easily go unnoticed if you're not vigilant. On the other hand, bright red blood may indicate bleeding closer to the end of the digestive tract, often from the rectum or the anus. This could be due to hemorrhoids, anal fissures, or more serious conditions like colon cancer. It's important to remember that not all rectal bleeding is visible. Occult or hidden blood in the stool can only be detected through specific medical tests. The key takeaway here is to be observant and proactive about your health. If you notice any changes in the color of your stool or experience rectal bleeding, don't hesitate to consult a healthcare professional. It might feel a bit embarrassing to discuss such personal matters, but remember, your doctor is there to help, not to judge. Early detection is often the difference between a treatable condition and a life-threatening one. So, don't dismiss this sign. It's crucial to seek medical advice if you notice blood in your stool or experience rectal bleeding. Persistent abdominal discomfort is another symptom not to ignore. This discomfort can manifest in several ways, such as cramps, gas, or a constant feeling of pain. It's more than just a fleeting sensation or the occasional stomach ache that we all experience from time to time. It's a persistent sensation, one that sticks around and doesn't seem to go away no matter what you do. Imagine having a stomach ache that lingers, not just for hours but for days, or experiencing waves of cramps that leave you doubled over in pain. Perhaps it's a constant feeling of gas, an uncomfortable pressure that makes it hard to concentrate on anything else. These are all examples of what persistent abdominal discomfort can feel like. Now it's important to distinguish this from normal digestive upsets. Everyone has an upset stomach now and then. Maybe you ate something that didn't agree with you, or you're feeling a bit stressed. These occasional upsets are usually nothing to worry about. But if you're experiencing discomfort that doesn't go away or keeps coming back, it's a different story. This type of discomfort is not typical, and it's not something you should ignore. It could be a sign that something more serious is going on. Remember, your body is a complex machine, and persistent discomfort is its way of telling you that something isn't quite right. So, if you're feeling constant, persistent abdominal discomfort, don't brush it off as just another stomachache. Listen to your body. It's giving you a sign that it might be time to seek medical advice. If you're experiencing constant abdominal discomfort, it's important to consult your doctor. Another sign of colon cancer is the feeling that your bowel doesn't empty completely. This sensation can be rather peculiar. Imagine the sensation after a normal bowel movement. You feel lighter, right? But in this case, it's different. Even after going to the bathroom, you might still sense a discomfort, a lingering unease, as if something is left behind. This isn't about those occasional instances when you eat something that doesn't agree with your stomach. We're talking about a persistent feeling, something that becomes a constant companion over time. It might not seem like a big deal at first, but it's the consistency of this feeling that can be a telltale sign. Remember, your body communicates with you in its unique ways. It's crucial to listen to these signals. If you're consistently experiencing this sensation that your bowel isn't fully empty, it's not something to brush off. It could be your body waving a red flag, urging you to seek medical attention. Pay close attention to your body, and if you notice this feeling persistently, it's time to see a doctor. There are a few more signs we need to discuss, so let's quickly go through them. Up next is sign 5. We have weakness or fatigue. This is more than just feeling a little tired after a long day. If you're constantly feeling drained or weak, it could be a sign that your body is trying to fight off something serious. Next, unexplained weight loss. If you're dropping pounds without trying, it might be cause for concern. This isn't about a few ounces here and there, but significant weight loss that doesn't align with your diet or exercise habits. Then we have nausea or vomiting. These symptoms can be related to many conditions, but if they're persistent and can't be explained by something like food poisoning or a stomach bug, it's worth getting checked out. Anemia is another sign to watch out for. This is a condition where your body lacks enough healthy red blood cells to carry adequate oxygen to your tissues, causing fatigue and weakness. Jaundice, a yellowing of the skin and eyes, is another symptom that warrants attention. It's often associated with issues in the liver or bile duct, which can be related to colon cancer. Finally, unexplained appetite loss. If you're normally a hearty eater and suddenly find you're not interested in food or you're eating significantly less than usual, it may be a sign of a problem. Remember, these signs should not be ignored. If you experience any of them, it's crucial to consult a healthcare professional. Now that we've covered the signs, let's talk about the importance of early detection and regular checkups. Detecting colon cancer at its earliest stages can significantly increase the chances of a positive outcome. It's like catching a train before it leaves the station, a lot easier than trying to catch up once it's already on its way. Regular screenings are a critical part of this early detection. Think of them as your body's annual service checkup, keeping everything in check and ensuring all systems are running smoothly. These screenings become even more crucial if you have risk factors such as a family history of colon cancer, obesity, or a lifestyle that includes smoking or excessive alcohol use. Early detection not only increases survival rates, but also opens up a wider range of treatment options. It's like having a full deck of cards in your hand, allowing you to choose the best strategy for your specific situation. But it's not just about screenings and doctor's appointments. Prevention plays a significant role too. Simple lifestyle changes can make a big difference in reducing your risk of colon cancer. Eating a balanced diet, maintaining a healthy weight, staying physically active, and avoiding tobacco and excessive alcohol can all contribute to a healthier you. Remember, colon cancer doesn't always show symptoms in the early stages. That's why regular checkups are so critical. They provide a safety net, catching potential issues before they become major problems. Regular checkups and early detection can make a huge difference, so please don't neglect your health. It's been an enlightening discussion about colon cancer, a topic we should all take seriously. We've journeyed through the 10 signs from changes in bowel habits to blood in stool, persistent abdominal discomfort, and that nagging feeling of incomplete bowel emptying. We've also done a quick rundown of the other signs. Remember, colon cancer is the third most common cancer in the United States, and it doesn't discriminate. The importance of early detection cannot be overstated. Regular checkups and screenings are your line of defense. Don't wait until it's too late, and never, ever ignore these signs. Being proactive about your health can make a world of difference. In the spirit of staying healthy, why not kickstart your fitness journey? Check out our calorie and protein calculator in the description below. It's an excellent tool for keeping track of your nutrition and meeting your fitness goals. If you found this video useful, please leave a comment below. Your feedback is invaluable to us. And before you go, thank you so much for watching our video, and please make sure to subscribe to our channel. If you want to reduce your risk of type 2 diabetes, watch the video on your screen next. Finally, remember to use our calorie and protein calculator in the description below to kickstart and track your fitness journey. It can be your companion and accountability partner on your journey to better health. Remember, your health is your wealth.